Leaving the hospital and going directly back to the stressors of life can sometimes be too much for patients. The new Transitions program at Doctors Hospital is designed to help patients leaving inpatient care. SNN Samantha Sonner has more.
Working through a mental health crisis takes a lot of hard work, and progress can start to unravel when patients return home.
When you go home, you're kind of stuck in limbo, and you still need additional support.
Kim Nielsen has been a patient at Serenity Place a few times over the years. And medical director of the Serenity program, Dr. Vladimir Einesman, says it's common for patients to have a hard time going back home.
At times the patient is anxious in order to rejoin the full functions.
That's where Transitions comes in to act as a bridge from inpatient to outpatient care. Patients will come for a few hours each day for group and individual therapy. Director of Behavioral Health, Michael Fitzgerald, says it will allow patients to build on their personal growth.
They do it in a real-time basis. They do it in a daily basis. So if anything is a problem, they can bring that problem back to the program the next day.
Fitzgerald says it will give patients a chance to see how the coping mechanisms they teach work at home.
Begin to solidify them in how they're going to use them in their everyday life, things like communication, conflict resolution.
Kim Nielsen says group therapy sessions will allow her to connect with people going through the same thing she is.
To build up trust with people and go in there and be able to talk about something that you might not be able to talk about at an outside meeting or something.
Nielsen says she and other patients will also benefit by continuing to see doctors and staff they're familiar with.
And I'm so happy that it's happening because so many people have asked about that.
Reporting in Sarasota, I'm Samantha Sonner, SNN, the Suncoast News Network.
Well, Medicare, Medicaid, and most insurance companies will cover the outpatient program.